February 19th marks a critical date for millions of Social Security recipients across America, and if you're collecting SSA, SSI, or SSDI benefits, what's happening with your payment could directly impact your household budget this month and beyond. Right now, beneficiaries are seeing payment adjustments based on the 2.5% cost of living adjustment that took effect in January 2026, and understanding exactly when your money arrives and how much you should expect is more important than ever. The Social Security Administration processes payments on a strict schedule tied to your birth date and benefit type, which means February 19th is a specific payment day for certain groups of recipients. But here's what many people don't realize. Recent changes in how the SSA calculates benefits, combined with Medicare premium adjustments and potential state supplement variations, mean your actual deposit amount might look different than you're expecting. Whether you're receiving retirement benefits, disability payments, or supplemental security income, the timing and amount of your February payment depends on several factors that have shifted in 2026. We're going to break down exactly who receives payment on the 19th, why some beneficiaries see different amounts than others receiving the same benefit type, and what the recent raise actually means for your monthly income after all deductions are accounted for. This isn't speculation or rumor. This is the real information directly from SSA payment schedules and the official COLA implementation that affects every single recipient. Let's dive right into what's happening with your Social Security payment on February 19th and make sure you have all the details you need to understand your benefits. The first thing we need to talk about is the payment schedule itself, because the Social Security Administration doesn't just send out all payments on the same day. They have a very specific system based on when you were born and what type of benefits you're receiving. And this has been the standard process for years now, but it still confuses a lot of people every single month. If you're receiving Social Security retirement or disability benefits, and you were born between the 11th and the 20th of any month, February 19th is your payment day. This is part of the staggered payment system the SSA uses to spread out the workload and make sure the system runs smoothly. Now, if you were born between the 1st and the 10th, your payment already came on February 12th, and if you were born between the 21st and the 31st, you'll be waiting until February 26th to see your deposit. But here's something really important that trips people up all the time. If you started receiving benefits before May 1997, you're on a different schedule entirely. Those long-term beneficiaries receive their payments on the 3rd of every month, regardless of birth date, which means your February payment actually arrived on February 3rd. Now let's talk about SSI, or supplemental security income, because those payments work on a completely different timeline. SSI recipients receive their payments on the 1st of each month, but here's where it gets interesting for February 2026. When the 1st falls on a weekend or federal holiday, the SSA sends the payment out on the last business day of the previous month. So SSI recipients actually got their February payment on January 31st, 2026, because February 1st fell on a Sunday. This is standard procedure, and it happens several times throughout the year, but it's worth understanding because it affects your budgeting and planning. The big news everyone's talking about is the 2.5% cost of living adjustment that went into effect in January 2026. This is the COLA increase, and it's based on the Consumer Price Index for urban wage earners and clerical workers, which is a mouthful, but essentially it measures how much prices have gone up for everyday goods and services. The Social Security Administration looks at the inflation data from the 3rd quarter of the previous year and uses that to calculate how much benefits need to increase to keep pace with rising costs. For 2026, that calculation came out to 2.5%, which means your monthly benefit amount went up starting with your January payment. Now, what does that 2.5% actually mean in real dollars? Well, it depends on what you were getting before the increase. The average Social Security retirement benefit before the COLA was around $1,227 per month. So with the 2.5% increase, that average benefit went up to approximately $1,275 per month. That's an increase of about $48 per month, which might not sound like a fortune, but over the course of a year, that's an additional $576 in your pocket. For people receiving the maximum benefit amount, which was around $4,873 before the increase, the new maximum is approximately $4,195 per month. That's a jump of about $122 per month, or nearly $1,500 per year. For SSDI recipients, the average monthly benefit before the COLA was approximately $1,542, and with the 2.5% increase, that went up to around $1,581 per month. That's an increase of roughly $39 per month. And for SSI, the maximum federal benefit amount for an individual was $943 per month in 2025, and with the COLA, it increased to $967 per month in 2026. For couples receiving SSI, the maximum went from $1,415 to $1,450 per month. These numbers represent the maximum federal amounts, but keep in mind that many states add their own supplements on top of the federal SSI payment, and those state supplements vary widely depending on where you live. Here's something that catches a lot of people off guard when they see their actual payment amount. Even though you got a 2.5% raise in your benefit, the amount that hits your bank account might not reflect the full increase. The reason for this is Medicare Part B premiums, which are automatically deducted from most Social Security payments. In 2025, the standard Medicare Part B premium was $174.70 per month, but for 2026, that premium increased to $185 per month. That's an increase of $1,030 per month in your Medicare costs. So if you're getting the average retirement benefit and you saw a $48 increase from the COLA, but your Medicare premium went up by $1,030, your actual net increase is only about $37.70 per month. This is why some people look at their payment and think the COLA didn't really help them much. But you have to remember that without the COLA, your net payment would have actually gone down because of the Medicare premium increase. The Medicare premium situation gets even more complicated for higher income beneficiaries because of something called IRMA, which stands for Income-Related Monthly Adjustment Amount. If your modified adjusted gross income from 2 years ago was above certain thresholds, you pay more for Medicare Part B than the standard premium. For 2026, if you're single and your income was above $106,000 or married filing jointly with income above $212,000, you're paying extra. The ERMA surcharges are based on income brackets, and they can add anywhere from about $74 to over $400 per month to your Medicare costs. This means some beneficiaries are seeing a much smaller net increase from the COLA, or in some cases, their take-home amount barely changed at all because the Medicare costs ate up most of the raise. Another thing that affects your payment amount is if you're still working while receiving Social Security benefits. If you haven't reached your full retirement age yet and you're earning income from work, there's an earnings limit that can reduce your benefits. For 2026, if you're under full retirement age for the entire year, you can earn up to $22,320 without any reduction in benefits. But for every $2 you earn above that limit, Social Security withholds $1 in benefits. If you're reaching full retirement age in 2026, the limit is higher. You can earn up to $59,520 in the months before you reach full retirement age, and for every $3 above that limit, $1 is withheld. Once you reach full retirement age, there's no earnings limit at all, and you can make as much as you want without any reduction in your Social Security benefits. These earnings limits go up slightly each year with inflation, and it's important to keep track of them if you're working, because the SSA will come back and recalculate at the end of the year if they withheld too much or too little based on your actual earnings. Let's talk about taxation of Social Security benefits because this is another area where people get confused and frustrated. Depending on your overall income, up to 85% of your Social Security benefits can be subject to federal income tax. The SSA doesn't automatically withhold taxes from your benefits unless you specifically request it, which means if your benefits are taxable, you might need to make quarterly estimated tax payments, or you could end up with a tax bill when you file your return. The thresholds for taxation haven't changed in decades, which means more and more people are finding their benefits are taxable as their overall income increases with COLAs and other income sources. If your combined income, which is your adjusted gross income plus non-taxable interest plus half of your Social Security benefits, is between $25,000 and $34,000 for an individual or $32,000 to $44,000 for a married couple filing jointly, up to 50% of your benefits may be taxable. If your combined income is above $34,000 for an individual or $44,000 for a couple, up to 85% of your benefits may be taxable. Some states also tax Social Security benefits at the state level, although many states have eliminated this tax or provide exemptions for lower-income seniors. As of 2026, the states that still tax Social Security benefits to some degree include Colorado, Connecticut, Kansas, Minnesota, Missouri, Montana, Nebraska, New Mexico, Rhode Island, Utah, Vermont, and West Virginia. However, most of these states have income thresholds or exemptions that mean many beneficiaries don't actually end up paying state tax on their benefits. If you live in one of these states, it's worth checking the current rules because several states have been phasing out their Social Security taxation in recent years. Now, if you're receiving both Social Security and SSI, understanding how your payments interact is crucial. When your Social Security benefit increases due to a COLA, your SSI payment typically decreases by a corresponding amount because SSI is a needs-based program. The SSA counts your Social Security benefit as income when calculating your SSI eligibility and payment amount. However, there's some protection built into the system. The law includes a provision that prevents your total combined income from Social Security and SSI from going down when there's a COLA increase. This means that even though your SSI might decrease when your Social Security goes up, the total amount you receive from both programs combined should be at least as much as you were getting before the COLA, and usually a little more. For people receiving SSDI, it's important to understand the relationship with Medicare coverage. After you've been receiving SSDI for 24 months, you automatically become eligible for Medicare, even if you're not yet 65 years old. This is a huge benefit, but it also means those Medicare Part B premiums we talked about start coming out of your SSDI payment. Some people are surprised when their SSDI payment suddenly drops by the amount of the Medicare premium after they've been on disability for 2 years, so it's something to plan for in advance. The good news is that if your income is low enough, you might qualify for one of the Medicare savings programs that help pay your Medicare premiums, deductibles, and copays. These programs have different eligibility levels, and if you qualify, your state Medicaid program pays your Medicare costs, which means you get to keep more of your SSDI payment. Representative payees are another aspect of Social Security that affects many beneficiaries. If the SSA has determined that you need help managing your benefits, they'll assign a representative payee who receives your payments on your behalf and is responsible for using the money for your care and well-being. Representative payees have specific legal responsibilities, and they have to keep records of how they spend your benefits and report to the SSA annually. If you have a representative payee and you think they're not handling your money properly, you have the right to request a change of payee or to have the payee arrangement reviewed. The SSA takes these responsibilities seriously, and they can take action against payees who misuse benefits. Direct deposit is something we really need to emphasize because it's the safest and most reliable way to receive your Social Security payment. If you're still getting paper checks in the mail, you're not only waiting longer to access your money, but you're also at risk of check theft, which has become a significant problem in recent years. The SSA strongly encourages all beneficiaries to switch to direct deposit, either to a bank account or to a Direct Express debit card if you don't have a bank account. Direct deposit means your money is available on your payment day without any risk of it getting lost or stolen in the mail, and you don't have to make a trip to the bank to cash or deposit a check. Setting up direct deposit is straightforward. You can do it through your My Social Security account online by calling the SSA or by visiting your local Social Security office. Speaking of My Social Security accounts, if you haven't set one up yet, you really should. This online account gives you access to your Social Security statement, which shows your earnings history and estimates of your future benefits. You can also use your account to request a replacement Social Security card, check the status of an application, change your address or phone number, start or change direct deposit, and get a proof of income letter. For people already receiving benefits, you can see your benefit verification letter, manage your Medicare prescription drug coverage, and if you live in certain states, you can even request to have additional taxes withheld from your benefits. The account is free, secure, and gives you 24/7 access to your Social Security information without having to call or visit an office. The appeals process is something every beneficiary should understand, even if you hope you never need to use it. If you disagree with the decision the SSA makes about your benefits, whether it's about your eligibility, your payment amount, or anything else, you have the right to appeal. There are 4 levels of appeal, starting with reconsideration, then a hearing before an administrative law judge, then review by the appeals council, and finally federal court review. You have 60 days from the date you receive a decision to file an appeal, and it's important not to miss that deadline because once it passes, your options become much more limited. Many people successfully appeal SSA decisions, especially at the hearing level where you can present evidence and testimony to an administrative law judge. Looking ahead to the rest of 2026, there are a few things to keep in mind about your Social Security payments. The payment schedule continues to follow the same pattern every month: SSI on the 1st, long-term beneficiaries on the 3rd, and everyone else based on birth date on the 2nd, 3rd, or 4th Wednesday. The benefit amounts will stay the same throughout the year unless there's a change in your individual circumstances, like starting or stopping work, getting married or divorced, or having a change in your living situation if you're on SSI. The next COLA won't be announced until October 2026, when the SSA releases the inflation data for the 3rd quarter, and that increase won't take effect until January 2027. If you're approaching retirement age and trying to decide when to start taking Social Security, the decision is more complex than just looking at the monthly payment amounts. Every year you delay taking benefits past your full retirement age, your benefit increases by 8% up until age 70. That's a guaranteed return that's hard to beat in today's market. On the other hand, if you take benefits early at age 62, your monthly payment is reduced, but you receive payments for a longer period of time. The break-even point where delayed benefits catch up to early benefits is usually somewhere around age 78 to 80, depending on your specific situation. But this calculation doesn't account for factors like your health, your other income sources, whether you're married and eligible for spousal benefits, and what you'd do with the money if you took it early versus waiting. It's a personal decision that depends on your individual circumstances, and it's worth spending time with the calculators on the SSA website or talking to a financial advisor who understands Social Security. The Social Security system is facing long-term funding challenges that you've probably heard about in the news. According to the latest trustees report, the combined Social Security trust funds are projected to be depleted in 2035. This doesn't mean Social Security will disappear. Even after the trust funds run out, incoming payroll taxes would still cover about 83% of scheduled benefits. But it does mean that Congress will need to make changes at some point to ensure full benefits can continue to be paid. Possible solutions include raising the payroll tax cap, increasing the retirement age, adjusting the COLA formula, or some combination of these and other changes. Whatever happens, current beneficiaries and people close to retirement age are likely to see minimal changes, as political realities make it very difficult to reduce benefits for people already receiving them or about to receive them. Your February 19th payment represents more than just a direct deposit hitting your account. It's part of a complex system that provides financial security for over 70 million Americans. Understanding how your payment is calculated, what deductions come out, when to expect it, and how changes in the program affect your benefits helps you plan better and catch any errors before they become bigger problems. The 2.5% COLA increase for 2026 is helping millions of beneficiaries keep up with rising costs, even though Medicare premiums and taxes mean the net increase is less than the gross increase for most people. Whether you're receiving retirement benefits, disability benefits, or SSI, staying informed about your payment schedule and benefit amount is an important part of managing your finances and making sure you're getting everything you're entitled to receive.